Good afternoon, everybody. The session 2 clinical updates will continue now. We have the first speaker, Dr. Meera Aladawi.
Thank you for the kind introduction. And I would like to thank the organizing committee and scientific committee for inviting me. Thank you, my friends, for all the encouragement and support everywhere. My name is Meera Aladawi. Today I'll talk about new horizon in treatment of generalized pustular psoriasis. This presentation is not sponsored by any company. This is a literature review according to the search that I've done. You all know that generalized pustular psoriasis is life-threatening condition. It is heterogeneous neutrophilic skin disease. It is mainly pustular rash and some erythema. It can be life-threatening. Patient can be debilitated, can be admitted to the ICU due to the severity of the condition, and you all know that this is a very rare condition. This is a condition that used to be called the von Zombach pustular psoriasis, and now this is a new terminology or other synonym, the generalized pustular psoriasis. The patient is not stable. Usually they have hyperleukocytosis, increase in the ESR, C-reactive protein, high liver enzymes, hypocalcemia, hypoalbuminemia, and they can have dysfunction in the hepatic, respiratory, and renal function. They also can have sepsis. Now, all the previous medications that we used to follow and treat the pustular psoriasis patients were following case reports and case series. It was not following FDA-approved medication, except for Japan. Japan have different exceptional and some approved medications that are used in Japan because they have more generalized pustular psoriasis than the rest of the world. The thing that treating patients with the previous medications that we used to use is used, but they are not validated, like not using validated scoring system to evaluate the improvement with the treatment. And this is difficult to say if this medication is good enough or not without a validated scoring system. And I mentioned in Japan, there are some medications that is approved, but there is no FDA-approved medication in USA or in European Union. Those are the medications that we used for generalized pustular psoriasis previously, and still some physicians are using, including acitretin, methotrexate, cyclosporine, some biologics like infliximab, anti-interleukin 17, anti-interleukin 23, anakinra, canakinumab, MMF, oral zinc, dapsone, and apremilast. Now, I would like to mention briefly that some patients with generalized pustular psoriasis can have mutation in the interleukin 36 receptor. And those people called this condition called the DITRA. And this mutation lead to all the inflammatory cascade to be increasing interleukin 1. And if we are treating the patient with anakinra or acitretin, it's acting on interleukin 1 and controlling the inflammatory cascade. Now, our new kid in the block, the new medication to treat generalized pustular psoriasis. The flare-up of generalized pustular psoriasis is very severe, life-threatening. The generalized pustular psoriasis is extensive, but what happens in the deep layer of the skin? The changes that happens, there is something called interleukin 36 receptor. And if there is binding of the interleukin-36 receptor agonist, there is a signal from this binding goes to the nucleus, and some cytokines goes to the dendritic cell. Cytokines release, leading to increased monocyte, neutrophils, and lymphocytes. And then severe inflammatory cascade developed, and then severe pustules, erythema, scales, life-threatening, can affect the patient life. And this is the generalized pustular psoriasis. The new medication is the spesolimab. Spesolimab, with lots of biologics. We need to remember all the new molecules now. For residents, you need to remember it for exam. Fine. Spesolimab is anti-interleukin 36. It blocks this receptor and blocks the signal to nucleus. There is no cytokines. Dendritic cell is relaxed. Monocyte, neutrophils, lymphocytes are relaxed. There is no inflammatory signal, and there is no rash. So what's spesolimab? It is the first FDA-approved anti-interleukin 36. It inhibits the signal through the pathway of interleukin 36. It is a humanized monoclonal antibody. Blocking this receptor stops the development of the rashes, and the patient rescued. All the erythema, all the pustules usually clear. So you have a patient with generalized erythema, pustules. You need to evaluate the patient. Is it pustular psoriasis? Is it generalized type? How you will evaluate the patient? You need a validated scoring system. And this validated scoring system is the Generalized Pustular Psoriasis Physician Global Assessment. It evaluates the pustular scores, erythema, and scales. In every aspect of the symptoms, you have the severity. Sorry, I cannot control this. 0, 1, 2, 3, or 4. You will notice it is here the clinical picture for each of the, like the severity of the rash. If the patient is having pustules mild, it will be similar to this picture, moderate or severe. And then you will write the scoring system for each of those. You'll divide it by 3 to find the mean level, and then you will evaluate the severity of generalized pustular psoriasis. If the patient has mild, moderate, or severe, you will treat accordingly, and you will re-evaluate the severity with time. How do we give this medication? It is IV medication. But before that, we diagnose the patient. It is generalized pustular psoriasis. Make sure that he does not have infections. It's contraindicated to treat patients with infections, especially tuberculosis. There is no tuberculosis, this is great. You can treat the patient. The dose is 900 milligram IV with slow infusion. The infusion takes 90 minutes. This is day 0, week 0, and we follow up the patient after 1 week. If the patient is clear, excellent. We observe until 12 weeks. If the patient still have rashes, we can give the second dose and observe until 12 weeks. Side effects. We are all worried about side effects. We would like to be safe while we treat our patients. Let's have a look to the side effects. Pyrexia, infection, prurigo, pruritus, urticaria, injection site reaction, infusion hematoma, fatigue, nausea, headache, and DRESS syndrome. I'll go again to those side effects in details in the study that is done to approve this medication. You cannot treat the patient if the patient has infection, especially tuberculosis. You cannot give live vaccine while we are giving this medication. There is no enough studies to treat pregnant ladies, breastfeeding ladies, pediatrics, and geriatric cases. If there is hypersensitivity to the medication, you cannot give it. Again, the infection, you should not give if there is any active infection, especially tuberculosis. So the study that used to approve spesolimab for generalized pustular psoriasis is called the INT'L. It is randomized, placebo-controlled trial. In this study, they took a group of people, different doses, and evaluated its randomized, comparing placebo to the treatment. I will not bother you with the details. Only notice, patients who were involved in this study had generalized pustular psoriasis, erythema, and pustules. Patients who have erythrodermic psoriasis were not involved. Patients who have palmoplantar psoriasis were not involved. Patients who have SAPHO were not involved. Patients with EGIP were not involved. So it's typical. Erythroderma and pustules generalized, and usually patient has other symptoms like fever, asthenia, myalgia. Those are exclusion criteria, and patients with hepatic disease were also not involved. So again, the patients included in this study were 53 patients. Two-thirds of the patients had placebo, the spesolimab, which is 35 patients, and 18 patients had the placebo. And then the same, week 1 and day 1, week 1, and followed until 12 weeks. So week 1, and then 12 weeks to follow the patient. And what's our primary endpoint? To clear the erythema and the pustules. You notice that in the scoring system, there is pustular scoring, and there is the whole score evaluation. So they are assessing both the pustules and the whole general evaluation score. Those patients included in this study, the generalized scoring system were 3 or more, which is moderate in severity and more, while the pustules starting level 2 and more. Of course, patients started other medications, but when they started this study, only 1 minute. When they started this medication, all the other medications were stopped in order to evaluate the spesolimab only. It was evaluated in 12 different countries, including United States, France, Tunisia, Switzerland, Germany, China, Japan, Taiwan, Korea, Thailand, Malaysia, and Singapore. I will not bother you with the details. We are worried about the side effects, the efficacy. After 1 week, improvement of pustules with spesolimab, 54%, with a placebo, 6% only. And the general evaluation of the scoring system with spesolimab improvement is 43%, 11% only with the placebo. This is one of the patients. Day 1, the severity of the erythema scales and pustules were level 4 and level 3. After 3 days, you will notice the improvement. The pustules cleared completely, there's scales and erythema. And after 8 days, patient had almost clear skin. At week 12, you will notice this patient evaluation was difficult to evaluate because there was no pustules. But after that, he developed pustules, scales, and erythema. At day 1, he started placebo. Yeah. By day 8, spesolimab started, and then you will notice the improvement. Before spesolimab, after spesolimab. Week 12, improvement. Not only the pustules and erythema, but also the pain improved, quality of life improved, the neutrophils improved, C-reactive protein improved. Safety is most important for us as dermatologists.
Dr.
There
Meera,
is...
Can we stop now?
Yeah, sure, we can stop. Thank you very much.